One of my most popular YouTube videos is called Why You Need to Pee at 3 a.m. with well over 1.7 million views so far. It's about how nighttime urination isn't mostly due to an enlarged prostate, but from untreated obstructive sleep apnea. While doing research for that video, I came across some interesting connections between obstructive sleep apnea and prostate enlargement. Could it be that sleep apnea can cause prostate enlargement, otherwise known as benign prostatic hyperplasia or BPH? Stick to the end and I'll reveal what you can do to either shrink your prostate, prevent it from getting larger, or even lower your chances of getting prostate cancer. And if you're a woman, I promise this information will apply to you as well. It's not just for men. First of all, I want to thank you for all your support and feedback on this channel. If you value the content that I offer, please subscribe to my channel right now and hit the thumbs up like button below. This will help my information to reach many more people out there. It's commonly accepted that men start to have problems urinating as they get older, along with waking up often to go to the bathroom at night. This is thought to be due to an enlarged prostate gland, which sits just under the bladder and wraps around the urethra, the tube that empties the bladder through the penis. This gland makes and squeezes out prostatic fluid along with sperm and fluid from the seminal vesicles during ejaculation. But how do you explain young men and even children who wake up a lot at night to go to the bathroom? They don't have large prostate glands at this age. Most of the time, nighttime urination gets better or goes away completely after treating sleep apnea. So here, it's definitely not from having a large prostate gland. In this video, I'm going to answer the following 5 questions. Number 1, can a large prostate gland cause nighttime urination? Number 2, what can cause the prostate gland to get bigger? Number 3, what else can cause your prostate to grow? Number 4, can sleep apnea lead to prostate enlargement? And number 5, what can I do to shrink my prostate or prevent further growth? Number 1, regarding whether a large prostate gland will lead to nighttime urination and other prostate symptoms, the findings are a bit surprising. Pretty much across the board, most of the studies I came across did not show any significant correlation between prostate size and nighttime urination. However, there were many studies showing a strong correlation between prostate volume and sleep apnea, BMI, and low testosterone levels. With regard to age, it's well documented that about 50% of men will have enlarged prostates by the time they reach their 50s, but some studies didn't show any strong correlation between age and prostate size. So there must be something else going on besides large prostates causing nighttime urination. And number 2, certain hormones can cause prostate enlargement. This study found that low levels of total testosterone and higher levels of E2 estrogen were linked to large prostate size. It's well known that testosterone goes down with aging, but one interesting fact is that estrogen goes up in men with aging as well. All this is not surprising because of an enzyme called aromatase, which converts testosterone to this E2 estrogen. And if you're overweight, the extra fat creates more of the enzyme aromatase, which converts testosterone to estradiol or E2. Now, estradiol binds 2 kinds of estrogen receptors in the body, alpha and beta. Estrogen receptor alpha stimulation leads to tissue growth, inflammation, and development of premalignant lesions, whereas estrogen receptor beta does the reverse, having a calming effect. Since androgens like testosterone block these beta anti-growth estrogen receptors, with lower testosterone, the prostate is more likely to grow. This process also lowers the activation of the GLUT4 glucose transporter process, blocking efficient uptake and use of glucose by fat and muscle cells. This can lead to insulin resistance due to too much glucose in your bloodstream. And number 3 is related to hormones called xenoestrogens. These are toxins in our environment which mimic estrogen and are strong endocrine disruptors. These can come from seemingly countless sources such as your food, water, plastics, receipts, canned foods, dental sealants, personal care products, sunscreens, furniture, and prescription medications. The list seems endless. Look up xenoestrogen sources on Google and you'll find tons of information about it. You can imagine why men's testosterone and sperm counts are coming down, especially in westernized countries. Having too much external estrogen causes problems in women as well, leading to what's called estrogen dominance with lowered progesterone levels. I talked about this in past videos, that lower progesterone will relax women's throat muscles, leading to more obstructed breathing at night, especially during perimenopause. Xenoestrogens also affect children as well. I did an interview with Dr. Leo Chosande on endocrine disruptors and their effects on children on my podcast, which I'll place a link to below. And number 4, is there any evidence that sleep apnea can cause your prostate to get larger? There's an important concept that I talk about in my book, Sleep Interrupted, regarding how your body responds to stress. In dangerous situations, like if you're being chased by a tiger, you'll either fight, flight, or run. But any kind of stress, whether from danger, job or relational issues, or poor sleep, can cause chronic stress, which activates your sympathetic nervous system. This diverts all your blood flow and energy to what you need to fight or run, your core muscles, your heart, and the reactive, more primitive parts of your brain. There's less blood flow available to your gut or your reproductive or genital urinary organs. When tissues are constantly deprived of blood, they send out signals to bring in more blood by producing growth factors that build more tissues, including blood vessels. You also have more inflammation as a result. With higher levels of cortisol, your glucose levels go up and your reproductive hormones, especially testosterone, goes down. Here's one of many studies proving that having obstructive sleep apnea significantly raises your chances of having a larger prostate gland, about 2.35 times higher risk. This study found that in men with sleep apnea, older age did not correlate with prostate size, but having sleep apnea was linked to larger prostates in younger men only. What researchers propose is that low oxygen levels at night can lead to inflammation and tissue growth. And this review paper connects lower urinary tract problems with intermittent hypoxia, obstructive sleep apnea, diabetes, and metabolic syndrome. And one last comment about prostate cancer. This is a personal issue for me since my father died of prostate cancer treatment in his early 70s just after starting radiation therapy. Before this, he was healthy and vibrant, active in a hiking club, auditing classes at Hunter College, and performing in a musical theater group. He had early prostate cancer that was picked up 10 years previously and treated with radiation seeds and hormone blockers, but it came back suddenly with small metastases to his spine. You may be wondering if having BPH gives you a high rate of getting prostate cancer. The simple answer is no. This review article clearly concluded that BPH is not a precursor to prostate cancer, but having BPH may make a diagnosis of prostate cancer much more efficient. When people think about any kind of growth in their body, the first thing they think about is cancer. I won't get into all the logistics and findings about screening for prostate cancer since it's extremely controversial, especially regarding using PSA as a screening blood test. We know that most men will have small amounts of prostate cancer as they get older with no ill effects. It's been widely said that more men die of prostate cancer than because of it. Prostate cancer incidence has remained at 21% over decades for all ages between 20 and 90, with cancer being found in over 50% of all men over 90 years of age found on autopsy. And 90% of these cancers are found to be very small and low grade. So by doing more testing due to BPH, you're going to pick up a lot of clinically insignificant small prostate cancers. And more testing leads to more procedures and more complications. If you look at this graph from 1975 to 2009 in New Zealand, you'll see the spike in diagnoses in the early 1990s in green, but no significant drop in death rates in blue. And it's no surprise to find that untreated sleep apnea was associated with having a 51% higher rate of prostate cancer in men ages 40 to 65. It's not just prostate cancer. Overall, sleep apnea raises your chances of getting any kind of cancer by 53%. And number 5, knowing all this, what can you do to prevent further prostate growth or to shrink it? You may have expected me to tell you to check for sleep apnea or use your CPAP machine more. Or you may have expected me to give you the names of various natural remedies or supplements. Yes, all these options may help to some degree, but you're not going to address the root cause, which is the triad of metabolic disturbances, obesity, and obstructive sleep apnea. If you take a medication or undergo surgery, it may help your symptoms partially or only temporarily. By addressing this triad completely, you'll also be addressing various other urinary symptoms such as incomplete bladder emptying and urinary urgency, as well as many other health problems as well. It's a systemic problem, not just a prostate issue. To start with, go through the steps that I listed in my last video on the 10 health habits that transformed my life and many other videos on my channel. The main priorities are to focus on optimal breathing during sleep, be metabolically healthy, and if you're overweight or obese, lose weight. This will require taking full responsibility for your own health and not on your doctors. Go ahead and continue to use doctors and other healthcare professionals for their expertise, but you make the ultimate health decisions. You'll also have to commit to eating a healthy diet, which is not beholden to the dietary guidelines that are heavily influenced by the food industry. It's also important to limit exposure to various toxins in your environment, including the xenoestrogens and many other toxins that you're exposed to every day. I'll cover toxins and optimal human nutrition in future videos. I hope you can now appreciate why you have an enlarged prostate from a radically different perspective. I know I gave you a lot of information, and your head must be spinning by now. If you need help from me to guide you on your upcoming New Year's resolution to take responsibility to transform your health once and for all, consider signing up for a virtual coaching session with me. If you register before the end of the year 2023, I'll throw in my 90-day sleep diet course as a free bonus, which is worth $99. It's a recording of a live 12-week course that goes through all the steps you need to tackle the triad of metabolic dysfunction, obesity, and sleep apnea through optimal nutrition, toxin removal, and everything else you need to know to handle sleep apnea and upper airway resistance syndrome. Even if you're thin and not overweight, this course will still be very helpful. The virtual coaching session will help you to focus on how to use the course properly so that you can get the results that you want. Imagine waking up more refreshed in the morning and having the energy to get things done and to enjoy life again. Click up here to register now. This special offer ends December 31st. I'm looking forward to helping you thrive in 2024.